Hello. So viewers, I was talking about the case history of my mother. As I told you earlier, she had been suffering for last 15 days. She had been suffering from swelling lower limbs as well as on the face. This was quite obvious, and she was feeling difficulty in walking. She was feeling enough of fatigue and of course nausea, loss of appetite. Uh, Depression. So all this she was complaining of. So I called her back to my hometown and started investigating on her. So her blood test revealed, when I undergone renal function test, so blood urea was around 83 and creatinine was 3.3, and serum potassium level was 5.5, phosphorus was 7.7, calcium was under normal limits, serum albumin was within normal limits, and rest of the investigations were normal. So, so it was a matter of worry. So now I want to discuss about this case. Now what we derive from this up till now, whatever I have said about the case history, including the complaints and the lab investigation reports. So what do you derive? Basically, the first and foremost thing is still she is more comfortable, and this is not a very, not that she has developed the symptoms immediately and rapidly, and she has not undergone in a very bad shape, but she is getting to the from good to bad and bad to worse. Slowly she is entering this stage. So now what do we derive from this? So this shows, as per the investigation, that she has been suffering from chronic renal failure, not from now, but must be from a longer time, which we never know. She must have been asymptomatic in between. So we never know, because her kidneys were functioning normally till now. So basically, what is the function of kidney? Kidney is basically it is a purifier of the blood. So all the toxin materials like uh, proteins, like ammonia and urea, uric acid, creatinine. So these are basically the toxic materials which are being filtered from the blood through the kidneys and then pass out to the through the renal system and into the urine. Through the urine it is out. All the toxic materials are out. So this is the function of the kidney. So now what happens in this case, chronic renal failure? This is just a brief I am discussing. Maybe in some other episodes I may be discussing in the detailed level. If I happen to get a company of some neurologist who will be interested in my case, then I may be discussing in the open house about my mother's case. So what happens is, the blood vessels, the toxic materials like urea, creatinine, they filter out of the blood through the glomerulus into the ureteric ducts, collecting tubules, and into the out into the urine. Okay, so this is what happens. Now in this case, basically urea was 83 and creatinine was also high, means the kidneys are not functioning. They are not filtering out, letting the this urea creatinine filter into them through the blood. So this process is not happening, not undergoing, because of which urea is getting increased in the blood, creatinine level is also getting increased, potassium is also getting increased. So calcium, basically calcium is also getting reabsorbed from the bones, and once in the blood they are also getting attached. Since they are also not being filtered out, they are getting attached to the phosphates, and the phosphorus level increases, and the calcium getting attached to the phosphates, making calcium phosphate crystals. And so calcium is also the bones are also deprived of the calcium, and bones get weakened because of this whole process. So this is one of the complications of the chronic renal failure, the generalized weakening of the bones, the most increased probability of the fractures in such cases. So this is what happening here. So since she had been taking calcium, so her calcium level is normal in the blood. The phosphate is mildly increased. But if she would not have been taking calcium orally for last so many months or so, then she might have got low serum calcium level and increased phosphate levels in the blood. So this is what. So now, what else can we expect? So first we will come to the causes. As I told you before, she had been taking rofecoxib for last 4 or 6 months, and celecoxib for last 2 months. So my first doubt goes to the this COX inhibitors. They must have caused toxic injury to the substance of the kidney, and because of which the aggressive damage of the kidney has taken place, and she has reached up to this stage now. Must be because of the complications of or adverse effects of the COX inhibitors. This is what the first thing I will take. And second, what I think is the episode which I told you, she has conked off on the floor. She became unconscious, and I think that is because now what I realize after going through the test reports, that her potassium was 5.5, which was at the increasing side. So that increased level of potassium might have caused the arrhythmia, cardiac arrhythmia, and because of this she has undergone this missing pulse, and then she suddenly got restless and got laid down on the floor, became unconscious for some time. And again, when the blood level, blood flow increased in the brain substance, so she again regained consciousness. That would have been the reason. So this is the other thing. Now, what else can be the other causes of the chronic renal failure? See, the causes can be divided into 3. One is pre-renal cause, renal cause, and extrarenal cause. The pre-renal causes are, so in case of pre-renal causes, maybe the cardiovascular causes like hypertension, like diabetes. So these may lead down to the damage to the kidneys and further the renal failure. And other pre-renal causes are the infections, either bacterial or viral, maybe fungal. These infections which will lead to glomerulonephritis. So this may cause the damage to the kidneys and further to the renal failures. Among the renal causes comes first and foremost common cause in the renal substance is the obstruction. Obstruction may be